continuing with the presentation of the evolution of the nursing discipline and how emerging technologies help us in the nursing professions and how the nursing profession in the ancient time and how we are practicing nowadays. So I would like to put some lights on the nursing discipline in nursing when the nursing was started in the beginning time. So it was started during the Roman Empire around 300 AD, when the people starts to provide the care to their relatives and their family members at their homes. Then later on, it was replaced by the hospitals in the small hospitals, and usually it converted into the small hospitals with some education. When the nursing profession is established, it's like a different profession. Before that, it was like informal type of caring to the patients. And Florence Nightingale, she was the woman who starts to providing caring to the nurses. We can see in the pictures, she was just educating to the other nurses with the help of some practical things and with evidence-based practices as well. So she encouraged the women to give the nursing education, and she also put some she merged some special emerged nursing into the from small hospitals to the some other bigger hospitals and make some other branches. So as we know that later on the hospital was small, and then there was a limited specialities, but now they have a different kind of speciality as well, and the hospitals are so converted into the like medical colleges and paramedical colleges. They have advanced research labs as well. So how this is the nursing profession is changed now. So how nurses evolve in the emerging technologies. So in the emerging technologies, we can see that this is a monitor, advanced smart monitor to monitor the vital signs of the patients continuously, because suppose that if the patient is on high risk, so we need to continuous monitoring for that patient. Usually we use the monitors in the ICU, operation theater, and intensive care units. So we don't need to go to the patient side, check the vitals again and again. So we are continuously monitoring. It helps to continuous monitoring, save the times as well, and it also helps us to provide some alarm, give us some alarming signs when there is an alteration in the normal range. So the another one is the medical administration. So we can see the infusion pumps, and here the nurse, she is setting the drop rates of the medication per hour drop rate. So now infusion pump are replacing that technique, because it is very accurate. If we need to put some patients on the morphine or some other narcotic high risk medications, so we don't take any risk in that case. So it also helps us to provide some medication like 1 ml per hour, 2 ml per hour. It improves the accuracy of the medication. So another one is the electronic medical records. So in the ancient times, we all the nurses back home in different countries, we have a different storeroom where we kept all the files in the hard works. But now we don't need to go to the search that file, so that patient who is coming to admit again to the hospital. So we just need to put some patient ID and data in the computer, and we will quickly revive that patient's medical past surgical history as well. So another one is the communication and telehealth. So it plays an important role in the remote area as well. So because if somebody's got any injury or any accident or any other shock, so we have nurses trained enough in Australia, those who can handle any emergency, but still they need the guidance from the GP, from the surgeon, from the doctors. But it can only possible with the help of the communication and telehealth, like for example Zoom or Cohort, and we have a lot of other applications as well. So evolution of nurses influenced by Florence Nightingale. So how the Florence evolution, she put some impact on the nursing profession. because she was the lady who starts the first nursing college in the London, nursing school in the London. So she put she encouraged the women to provide care to the patients, and she encouraged the ladies and to give them education, particular education before they going to attend the residence. Before that there was nothing like that, nothing, no study and no program was there to provide care to the patient, and she starts the schools which make the nursing is like a different profession. And then she also give importance to the ventilations, to the environment, how the room would be the patient, how we can make it clean, and the how fresh air is the importance for the patients. And she also give the importance to the drainage to reduce infectious diseases. As we know, all knows that she played an important role during that time in war, and because of most of the soldiers were injured, they were not dead due to their injuries, or their due to any other because they were injured because of infectious disease, because of wounds. So that's why she focuses on the drainage to reduce the infectious diseases and hand hygiene as well. So this is all about the evolution of nursing. So I would like to invite Rashpinder Kaur, who will continue with the environmental theory as well. Thank you so much.